We're live. I'm going to just very quickly check if everything is okay. Let's see. Just a second. There is always a delay. I know that we're on Facebook for sure, but I don't see us on YouTube. Okay. Well, it doesn't matter. We'll just do it. Okay. So, my name is Dr. Karina Kaplun. I'm specializing in gut microbiome, probiotics, and prebiotics. And today I have a special guest, Colleen CutCliffe, who is also an expert in probiotics. She's actually a CEO and founder of the company called Pendulum. It's a probiotic of the next generation. And today we're going to be talking exactly about that, about the next generation prebiotics. And very excited to have you here, Colleen. Thank you so much for finding time. And if you don't mind, could you please introduce yourself a little bit more and tell us a little bit about yourself, about your background, and what brought you to the field of probiotics?
Sure. Thank you so much for having me. And I'm excited to share out what we've been building and answer any questions that people have. So my background is in science. I have a Ph.D. in biochemistry and molecular biology from Johns Hopkins. I did a pretty traditional postdoc at Northwestern University, and then I moved out to San Francisco to work for a pharmaceutical company. We were developing drugs for Parkinson's disease. So I started on the pharma side of the house.
Mm-hmm.
Then I joined a startup company, which is what everybody does when you live in Silicon Valley. It was a DNA sequencing instrument company. It went through very rapid growth, went public. And on the other side of that IPO, I started this company with two co-founders. We're all very technical. I'm a biochemist. Jim is a biostatistician. John is a physicist. And the whole premise of starting this company was that things like probiotics and yogurts have been on the shelves for decades and decades, but microbiome science is actually a relatively new science, which is premised on DNA sequencing. So actually, if you go into PubMed and you do a search for microbiome, you can see that up until the kind of the 2000s, there are no publications. And that's because DNA sequencing technologies were finally inexpensive and usable enough that people could apply them to look at all of the tens of thousands, maybe hundreds of thousands of different microbes that reside in our microbiome. And it turns out that there's a lot more than what's on the shelves today that's in our bodies, and they're playing a really important role in disease and health. And on a personal note, as I was learning more about the microbiome, I came across a study which showed that children who are systematically on antibiotics are systematically more prone to chronic illnesses later on, including obesity, type 2 diabetes. The study was actually recently repeated by the Mayo Clinic, and they showed that children who were on antibiotics systematically were more prone to not just obesity and diabetes, but also allergies, asthma, ADHD, celiac disease. And the reason this study was really compelling for me is because my first daughter was born almost 2 months prematurely. And in the intensive care unit where she spent the first month of her life, they gave her antibiotics, which is standard for preemies because they're so fragile. But what the antibiotics did was to completely decimate her microbiome and start her on a path of, a different health trajectory than the rest of us. And I could already tell when she was in elementary school that she was different. She had more food sensitivities than the rest of us. Her metabolism was different. And so for me, it was like, okay, we have the technology to be able to survey the microbiome, create new interventions that could help millions of people, including my own child. So why not give it a shot?
Oh, thank you so much. I didn't know the story about your daughter, but thank you so much for sharing. Um, yes, antibiotics have been drastically overused by by everyone really. And on one hand, they're incredibly useful and can save lives, but on the other hand, they can set us on the path for different chronic diseases, correct? So okay, so you have your personal story, which makes sense. So how did you actually come to discover a totally new probiotic, and why did you decide to choose Akkermansia, which is so hard to grow?
Well, I think much like many things in life, you don't know how hard it's going to be, and so you naively enter into it. I think for us, all of it was premised on research that we were doing and people actually around the world were doing, trying to survey the microbiome and looking for things that healthy people have in vast abundance and people with illnesses are low or entirely missing. And then trying to understand what could possibly be the mechanism of action for these different strains and is there a therapeutic potential? And so for us, when we were doing this work, what we found was there were sort of two categories of strains that were really interesting to us. One are strains that are responsible for producing butyrate. And this is a multi-step biochemical reaction, which starts with ingestion of fiber. Fiber is metabolized through butyrate to butyrate through a multi-step process. And so we pull together all the strains involved in both the primary and the secondary steps of that metabolism. And then the other category of strains are ones that are involved in the regulation of the mucin layer of your gut lining. And this is where Akkermansia becomes very interesting because it is currently the only strain on the market that literally lives at the gut lining. And its job is to make sure that that gut lining is strong. And when I think about the role of that, I think about actually in my backyard, I have a wooden fence. And when we first moved in, this fence was brand new. The planks were strong. They kept the elements on the outside, and then my yard on the inside. But what can happen over time through weather and aging is those planks can start to wear down and even start to fall. And then, of course, it's a big disaster because now you're seeing into your neighbor's yard and they're seeing into yours. So the gut lining is very similar. It's basically like a fence that has planks that keep it intact. And what can happen over time with aging and stress, actually, is that you can start to get wear and tear on those planks. Akkermansia lives right at that fence, and its job is to all day long make sure that fence is strong. When the fence gets weak, it repairs it. When the fence is having issues, it's there to solve that problem. And so it turns out that Akkermansia is really emerging as a keystone strain because when those planks fall and when your gut lining is not intact, it shows up in a lot of different ways, not just your typical GI issues like constipation and diarrhea and bloating and gas, but also reduced metabolism, increased inflammation, reduced immune responses. So also actually even worse skin. We have people that are seeing skin issues. And so it turns out it's a very important strain. So we thought, oh my gosh, we have to go after. I'll tell you also, Akkermansia, based on its genes, is a putative GABA producer, which is known to be a regulator of stress and anxiety. So we thought, oh my gosh, we have to figure out how to bring this strain to the world. And it turned out to be a very difficult strain to manufacture. But, you know, for all of us who've chosen to be health and medicine, we push through those things because our end goal is we want to bring this thing to the world.
Thank you. So, so you said that Akkermansia plays a very important role in actually making our gut lining healthy. Do we know any mechanisms? How does it do it? What actually it does to make it, does it strengthen the maybe tight junctions between cells, or what does it do?
Yeah, well, first of all, this is the science is still early, and so we're still
Okay.
understanding exactly what it does. But there are a few things that we know that it does. So we know that it can actually consume mucin. So mucin is kind of the glue that holds these
Mhm.
planks together. And so Akkermansia, when this glue is sort of getting old, is able to consume that mucin so that you can replenish with new more strong mucin. That mucin layer is really important because it holds receptors for the small molecules that are created by the microbiome. So we also know that Akkermansia assists with the production of butyrate. And butyrate is a really important small molecule created by the microbiome because, and when we think about metabolism in particular, butyrate binds to G protein coupled receptors, which sit in the mucin layer, And that signals your body to have the right insulin and glucose response when you consume sugar. And so if you're low in either the production of butyrate or you're low in the response to that butyrate, you now have metabolic issues. And there's other things that butyrate plays a really important role in terms of colon health. But for us, we were really looking at it from that metabolism side.
And you did do clinical studies, correct?
We did in vitro, preclinical, clinical. We really developed these products the same way you would a pharmaceutical drug, where you're really getting into the mechanism of action, showing how the thing works, demonstrating in both animal and human models that that's working. And so, yes, and I should say, like our we have a published placebo-controlled double-blinded randomized trial in BMJ showing that our formulation compared to placebo is able to lower A1C by 0.6 points and lower blood glucose spikes by 33% in people with type 2 diabetes. So really strong efficacy with a natural product.
It's amazing. And I think it's incredibly important that you're actually doing it, correct way, like a drug, because it is a scientifically proven probiotic. Basically, we know that it works in a controlled clinical study. Why do you think it's important to nowadays to actually have probiotics like that? Because there's so many probiotics. I feel like anyone, literally my neighbor, can just go out and make a probiotic in his house. So do you think we have a problem? Do you think we have a problem on the market? How do we explain to the consumer that it is important to choose not only science based, but clinically tested probiotics and proven, not only tested, but actually proven to work?
I think you're hitting the nail on the head on the biggest challenge in this industry. But let me start by saying, first of all, the probiotics industry, this is a $60 billion industry. So it's and growing. So why is that? It's because people are all trying to do good things for their health and they believe that probiotics are beneficial for them. And so we're starting in a great place, which is that people are investing in their health. They believe that probiotics are a natural way to help them boost their health. Now, the issue is, as you said, if anybody here has ever stood in a grocery store and looked at the shelves and shelves of probiotics and thought to themselves, oh my gosh, which one should I go with? You are not alone. And most of those products are more or less the same ingredients with just some new marketing, packaging, and innovation. And so that is a big challenge. And for us, I think it's very hard for people to discern what is based in real science and what is great marketing of science. And so with Pendulum, one of the things that we have experienced that is different from all the other probiotics out there is an extremely high retention rate. So we have returning customers at almost 100% because they are reaping benefit from the product. And if they can get through those first 90 days, it's actually after that first 90 days, that's when we start to see the retention really get crazy. But if people can get through those first 90 days and see benefit, they really stick with the product. And so I say the proof is in the pudding. If you try a probiotic, doesn't do anything for you, keep experimenting, and hopefully you'll stumble on ours at some point and you'll realize this thing is actually making a difference for me. We get people reporting lower A1C, lower blood glucose spikes, lower fasting glucose, in addition to the soft benefits that come when you improve your ability to metabolize sugar. So sustained energy, people don't have that post-lunch slump, better workouts, reduced brain fog. We have 60% of our customers have reduced sugar cravings, weight loss. So there are all these other benefits that you will experience if the probiotic actually works. And so that's kind of what we're banking on. The proof is in the pudding.
So, who do you think should take Pendulum? Do you think anyone can benefit from it, or do you target a specific audience with, for example, type 2 diabetes, or not necessarily?
With glucose control, the studies we did were in people with type 2 diabetes. But many of us know that as we age, our ability to metabolize sugars is one of the first things that starts to go down. And I don't think we need any blood tests to tell us our metabolism is slowing down as we age. Most of us recognize it and feel it. And so if you kind of look at all the studies talking about biological age, one of the most important indicators of whether you're aging healthy is whether your body can still metabolize glucose as well as when you were younger. So, if you don't have type 2 diabetes, but you are aging and trying to
Mhm.
bolster your microbiome so that you can bolster your metabolism, it's a product for you. So, I don't have prediabetes or diabetes, but I am on the product. My 15-year-old daughter is on the product. My 70-year-old mother is on the product because to me, your body's ability to metabolize sugars is such a fundamental core part of your health that I want everybody in my family to be working on that.
Wonderful. So you mentioned your kids as well. How early can a child take a probiotic? Are there any contraindications for children or not?
We have not done any clinical trials in children. But I think many of the people that we talk to are giving it to their kids, but we haven't done any clinical trials on it. And so um,
You can't.
I can't say.
Okay. Okay. All right. Well, that's very interesting. Do we know if there are any side effects for this probiotic? Have your any of the clients or in the clinical study have you noticed any side effects?
Yeah, actually, it's funny. Our chief medical officer, who's been running diabetes trials for his entire career, 50 plus years, said this is the first trial he ever ran where there were more adverse events in the
Oh,
placebo group than in the intervention group. But that being said, I think what customers most likely experience is GI impact. So for some people, it's a GI improvement right out of the gates. But for other people, especially if you're low in Akkermansia or low in butyrate production, when you first start taking these pills, it's really disrupting your microbiome and it can show up as actually increased bloating and gas and diarrhea and constipation. So for those individuals, we tell them, okay, reduce your dose because your microbiome is, you don't want to like jolt it, right out of the gate. So take a pill every other day, slowly introduce this strain into your system. And for those people, once they push through, and usually it takes, a couple of weeks, then they start, the tables turn. And then all of a sudden, everything's so much better for their
yeah,
digestion. But, if you're depleted and really depleted in these strains, you'll feel it when you first start
right
taking.
away.
Yeah.
I agree. I actually see the same experience with my clients, and not only with Pendulum, but with many other probiotics. If they're lacking those bacteria, and suddenly you start incorporating them into your routine, it can actually get worse first before it gets better. And we kind of need to get along with it and try our best to get over this period. And sometimes by minimizing the concentration, I agree with that. But also, there was a question. Mhm.
Sorry to interrupt you, but I am curious with your patients when they start on, let's say, Akkermansia, how long does it take them to kind of push through this initial potential GI distress?
Well, it's usually is about a week or two, and I find it the same with, for example, fermented foods. A lot of people report, "Well, I can't eat sauerkraut," but they never even gave it a chance to eat the sauerkraut. They try once, they start being bloated, they don't like it, and they never go back again. They
Yeah.
just, they don't realize that they need to start slowly, but go that direction. Sometimes literally just take like a teaspoon, for example, of fermented foods, and then slowly increase, exactly the same way as with probiotics and prebiotics as well. So yeah, I see the same thing. I also actually see, since we're talking about depletion of Akkermansia, I see a lot of my clients don't have Akkermansia, or some of them do have Akkermansia in their gut, but a lot of them don't. And when they start on Pendulum, we actually see it eventually when we retest.
Yeah.
But what I wanted to ask you is, do you have any studies? Have you done any test on actually colonization? How do you know if Akkermansia is actually able to colonize the gut after, how long do you need to take Akkermansia for? Because people usually want to, spend just a month worth of probiotic, just take it and then go back to their normal life. What would be your
Yes.
recommendation?
Colonization is a great question and something that, of course, we would all love to strive for is to not have to take the strains anymore. Well, I think the question sort of starts with, why are you depleted in Akkermansia? There might be a wide variety of reasons you're depleted. One could be things that you have control over, so your diet, your exercise, although I'm not sure I have control over my diet, but I think that, in theory, we have control over our diet and exercise. But there are other reasons that a person might be depleted in Akkermansia that are unrelated to that. So we know as we age, we get depleted. As we go through periods of stress, we get depleted, which all of us have been going through periods of stress in the last few years. Actually, our circadian rhythm, as we go to different time zones, that also can cause our microbiomes to become depleted. For us women, when we go through menopause, our microbiome gets depleted. So there are things that are just happening as being part of a human in life that can cause you to be depleted. And so the question about colonization is, if those things that cause you to be depleted are not able to be changed, are you going to be able to colonize? That being said, we did a trial where we gave people product for 90 days, and then we told them to stop taking the pills for 30 days, and then we tested their microbiomes, before and after. For most people, the strains were gone, but for about 15 to 20% of them, they still had Akkermansia in their system. So, of course, we don't know exactly why it is that those individuals colonize. We actually deliberately ask people, please don't change anything in your diet or your lifestyle, because we want to know what is the effect of the probiotic by itself. But it's possible that when people start to feel benefit, it can also alter your behavior subconsciously. And so if you were to increase your intake of prebiotics that would help feed Akkermansia, you could potentially increase the chance of it colonizing. So, for example, if you increased your intake of fiber, or you increased your intake of polyphenols, that could be good enough to help your Akkermansia colonize, even with aging and stress and all of these things happening.
That's amazing. So you actually looked at Akkermansia presence after 90 days, and then the washout period, and then you looked at it again, right?
Right, exactly.
So you saw Akkermansia in all of your patients when they were taking it. That's amazing. I actually also can share. I think I shared that story with you, that I also was depleted with Akkermansia, and then I started using Pendulum, and then I had it back, and now I've been off Pendulum for some time, and I just recently tested my microbiome, and I don't have it, even though I actually am trying to eat a lot of fiber and fermented foods. It's just some people, we don't exactly know the mechanism yet. Sometimes we can do our best to increase the colonization, but sometimes it just won't colonize. So if we really are depleted, I think it's a good idea to just kind of on a regular basis use this probiotic. It's like a vitamin, right, that we need. There is a certain percentage of vitamin C, milligrams, like 100 milligrams of vitamin C, that we need to take with the diet. And if we don't take it with the diet, then we can cause a depletion of vitamin C. The same thing with probiotics.
Yeah,
And
your story is so great because you clearly know what is the right nutrition and working on that. And I think it's important for people to hear your story because um, a lot of times we feel like, oh, it's my fault. I could be doing things differently. I could be doing better. But the truth is, with your microbiome, for many of these, it really is out of your control. Even though you're doing all the right things, your microbiome might not, and your body just might not be the environment that allows these really important strains to grow. And Akkermansia has not been found in any foods. So there's no other way to get it back. And so I think that's important for people to know that you're giving your body something back that you might not have another way to have.
I agree. Thank you for sharing this with us. I also wanted to talk a little bit about, you mentioned that Akkermansia is very special in the sense that it grows in the mucin layer, right? Right next to the gut barrier function. So it actually improves the barrier of our gut, right? It makes it less permeable or less leaky, like some people say. What else is special about this strain? Why, for example, Pendulum is a little bit more expensive than some other probiotic strains? Why such a big difference in the price?
Sure. There are two things about this strain that make it very difficult to grow. Actually, I should start by saying that the price is set because of how much it costs us to make the strain. And in fact, my investors would be really mad if they heard this. But when we first started selling the pot product, we were actually losing money on every bottle because they're just very expensive to make. But there's two things about this strain that are unique, that make it really effective, but also make it very hard to grow. The first is that your gut microbiome. So you have your stomach, your colon, and then you get to the distal colon. This is where actually the gut microbiome is. It is anaerobic, and what that means is that there's no oxygen there. And so when you have to grow this strain, you have to grow it in a setting where there's no oxygen. There's oxygen everywhere all around us. So we ended up having to create a manufacturing plant that end to end keeps oxygen entirely out of the system so that we could grow this strain. The second challenge about Akkermansia is not only can it have no oxygen around it when it's growing, it also is used to living in at this gut lining, eating this mucin, which is actually kind of a beef byproduct. And so we want to grow these strains in a vegetable-based media. And if you want to be able to grow them in vegetable-based media in a big tank instead of sitting inside your gut lining, that's another kind of physical barrier to being able to grow the strain. So something that lives in an anaerobic environment, living in your gut lining, feeding on the mucin layer, and now you have to grow it in a vegetable-based media in a tank outside of the gut. That transition is very hard. All of the probiotics that are on the shelves today, they don't have these features, but that's also what makes Akkermansia so effective.
Tell me about it. I've been working with different types of bacteria in the lab and trying to grow them in vitro. And I actually worked with some Alistipis strains that were also growing on mucin that made them interesting. And
Yes.
it's really interesting. You mentioned also that Akkermansia can produce GABA, so which means that it potentially can affect our gut brain microbiome access, right? And maybe help us with stress and maybe even with some pain. I actually worked on another bifidobacterium dentium, and my recent publication was on the strain that produced GABA, and we did preclinical styles. It was very interesting. It actually was modulating in visceral pain in the gut. So I find it very interesting that all these bacteria, they have so much potential, and they're really there for the reason, right? So we can't just ignore our gut microbiome, and really I think those of us who are taking care of microbiome will probably um, ahead of a lot of other people who are just not looking at it at all.
Well, I hope we can bring everybody into this world where they know about the microbiome and they're thinking about
Mhm.
it and improving their health through this organ that really is true. Not that many people are thinking about.
Yes. Well, and the last question, I know that you have to run and we're short on time, but what would be your like three advice or activities that people could change in their everyday life to improve their gut microbiome?
Sure. I think that diversity of the microbiome has been shown to be one of the most important things. So, the more activities that your microbiome can do, the better. So, the ways to increase diversity of your microbiome is to increase the diversity of your food. So, I think the number one is try to eat more varieties of foods. Of course, more fibers, more polyphenols, those are all great. But generally speaking, the variety is actually one of the most important things. So, diversify the food that you're eating. The second thing is, think about antibiotics. I'm not an anti-antibioticer. I think they're very important. They save millions of lives throughout the centuries, but don't go ask your doctor for an antibiotic or insist that you have to take an antibiotic because it does have this negative side effect, which is that it decimates your microbiome. We do have immune systems, and also if you have a viral infection, that antibiotic isn't going to do anything for your disease. So, the second thing is to really be thoughtful about taking antibiotics and talk to your doctor about what are the downsides to this and do I really need it, and have a good open conversation with your physician. And then the third thing, so diversify the food you're eating, think it twice about an antibiotic and talk to your doctor about it. And the third thing, of course, is take the probiotics from Pendulum, which will help you special strains.
Thank you. Yeah, no, Pendulum is definitely a next generation probiotic, and I hope we will get many more next generation probiotics. Now that you have a facility, hopefully you can bring us a better diversity, right? It's a good start. You're definitely a leader in the game. Oh, I forgot to ask you about the. Do you have another minute just for another last question? Because we know that the Europe also is working on Akkermansia, but it's going to be a heat inactivated Akkermansia strain. So, what are your thoughts about heat inactivated bacterium versus the live bacterium? What's better?
Yeah, that's a great question. And I should say there are lots of people around the world working on Akkermansia, and the knowledge about it and the learning is going to just continue to increase. The difference between a live bacteria and a heat killed bacteria is that one does have the potential to colonize. And the live bacteria is producing all of the small molecules that are helping you with this benefit. The live bacteria is the one that is sitting at the mucin layer, understanding when the planks are getting weak, understanding how to regulate that, and having a direct interaction with other microbes in this ecosystem. A heat pasteurized Akkermansia is basically a dead version that has the molecules that that bacteria made when it was alive. But essentially, what you're doing is you're killing it and you're saying, oh, I just want these small molecules. So it will never have the potential to colonize. It cannot react to the ecosystem it is in. It cannot actually regulate anything because it just has these small molecules in it. And so there are some benefits to the heat pasteurized version, but nowhere near having the live version. I think about it like if you bought a car, would you rather buy a car that has an engine and runs, or would you rather buy one that somebody smashed to bits? The one you smashed to bits, there might be screws and little parts of that car that you could resell and are useful for you, but it's not going to get you from point A to point B. So that's really the difference between these two.
That's a good analogy. I like that. Well, thank you so much. Well, thank you so much. Let's then finish on this note. And thank you so much for coming and spending this time with us. And I hope you can come back later at some point, and we can continue the conversation.
Absolutely. Thank you so much for having me and for helping to spread information about products that have clinical trials behind them.
Thank you.
Thank you.